Welcome to the Deep Dive. Today, we're going to jump right into something really important for mental well-being.
Yeah, two major approaches.
Cognitive behavioral therapy, CBT, and rational emotive behavior therapy,
Yeah.
or REBT.
Mm-hmm.
We know you want to kind of get a good handle on these,
Yeah.
understand them quickly, but also, properly.
And that's exactly what we're aiming to do, give you that solid understanding.
That's the mission today.
Absolutely. And look, these aren't just abstract ideas. Both CBT and REBT, they're really well supported by research.
Right, they're evidence-based.
They are. They're tools therapists use effectively for, well, a lot of things. Depression, anxiety, certainly.
Addiction issues, trauma recovery,
The whole gamut, really. So we'll break down the core principles for you, the main techniques.
and maybe even touch on how you might use some of these ideas yourself day to day.
Definitely. Some practical takeaways.
Okay, sounds good. Let's start with CBT then. Can you unpack the fundamental idea for us?
Sure. The absolute core of cognitive behavioral therapy is this tight link between three things: our thoughts, our feelings, and our behaviors.
Okay, good.
Connected, very connected. They're constantly influencing each other. And here's the powerful part. If you can learn to change your thoughts, you can actually influence how you feel and what you end up doing.
Can you make that a bit more concrete, like an everyday example?
Yeah, absolutely.
Yeah.
Imagine you make a mistake during, say, a work presentation.
Okay. Happens.
Right. An immediate thought might pop into your head. Oh no, I'm going to get fired. I'm just not cut out for this.
That negative self-talk.
Exactly. That thought, it almost certainly leads to feelings of anxiety, maybe shame, maybe dread. And what might you do next time? Maybe you avoid volunteering for presentations, or you procrastinate heavily. See the chain? Thought leads to feeling, leads to behavior.
Yeah, I definitely see that. So CBT is about interrupting that chain somehow.
That's precisely it. CBT teaches you first to just notice these automatic negative thoughts, the ones that just, appear without you consciously choosing them.
Become aware of them.
Yes. And then, importantly, to examine them, like a detective questioning a witness. Instead of just accepting "I'm not good enough" as truth.
You challenge it.
You challenge it. You ask, okay, where's the actual evidence for this thought? Is there another way to look at the situation? Maybe a more balanced way.
Right.
The key insight, really, is that those negative feelings often feel automatic, but they're usually triggered by thoughts we can learn to catch and change. That's where the sense of control comes from.
Okay, so it's about actively managing those thought patterns. What are some of the specific techniques CBT uses?
Well, a big one is cognitive restructuring. That's the process of actively identifying those unhelpful thoughts and working to replace them with more balanced, realistic ones.
So instead of "I'm a total failure,"
Maybe something like, okay, I messed up on that point, but overall the presentation went okay, and I know what to fix next time. It's about finding that middle ground.
makes sense.
Then there are behavioral experiments. This is where you might test out beliefs. If you think, if I speak up in meetings, people will think I'm stupid, you might design a small experiment.
Like deciding to make one specific comment in the next meeting.
Exactly. And then objectively observing what actually happens. Did people ridicule you, or did they just listen? It tests the reality of the fear.
I like that. Practical.
And mindfulness and grounding techniques are often woven in too, helping you stay present, notice thoughts without getting swept away, reduce that anxiety buzz.
It sounds very structured and hands-on.
It really is. CBT is often structured. It's usually time limited.
Yeah.
You're not necessarily in therapy forever, and it's very focused on building skills.
Skills you can keep using.
That's the goal. Lifelong tools.
Okay, that gives us a really good picture of CBT. Now let's shift gears to REBT, Rational Emotive Behavior Therapy, developed by Albert Ellis back in the 50s, right?
That's right, a pioneer in the field.
How does REBT differ in its core focus?
Well, REBT definitely agrees that thoughts influence emotions, like CBT. But Ellis, he argued we need to dig a bit deeper.
Deeper than the automatic thoughts.
Yeah. He focused on the underlying beliefs, often irrational, rigid beliefs that fuel those negative thought patterns and cause unnecessary emotional suffering.
Ah, so it's going for the root cause, the belief system itself.
Exactly. It's not just the thought, I failed, but maybe an underlying belief like, I must succeed at everything I do, and if I don't, I'm worthless. See the difference? It's more fundamental.
Yes, that feels very rigid.
It is, and REBT uses the ABC model to map this out very clearly. A is the activating event. Something happens. Let's say a friend cancels plans last minute.
Okay, the A.
B is your belief about that event. Now, this is crucial. An irrational belief might be, this is terrible. Friends should always follow through. This proves they don't really like me.
That sounds like a strong reaction to cancel plans.
Right, because the belief is rigid and demanding. And C is the consequence, the emotional fallout. Intense hurt, anger, maybe deciding not to trust that friend anymore.
So the belief drives the consequence, not just the event.
Precisely. A different belief, like, it's disappointing, but things come up, would lead to a very different C, maybe just mild disappointment.
That's a powerful distinction.
Yeah.
So what does REBT do about those Bs, those irrational beliefs?
That leads us to D, disputing. REBT actively teaches you how to rigorously challenge those irrational beliefs.
How do you dispute them?
You question them directly. Is it realistic to demand that friends always keep plans? Where's it written that this must happen? Is this belief actually helping me feel better or connect with people? You poke holes in it.
Putting the belief on trial, essentially.
Yeah, that's a great way to put it. You examine its logic, its usefulness, its basis in reality.
And after disputing, what's the aim?
The goal is developing effective new beliefs. These are rational, flexible, and more helpful ways of thinking.
So instead of the demanding belief,
You might cultivate something like, I strongly prefer my friends to keep plans, and it's disappointing when they don't, but it doesn't mean they don't care, and I can handle the disappointment. It's about preference, not demand.
that definitely sounds less stressful, more flexible.
It really is. And REBT places a big emphasis on things like unconditional self-acceptance, accepting yourself, flaws and all, whether you succeed or fail, whether others approve or not.
Regardless of performance.
Exactly. And developing a generally rational philosophy of life, taking emotional responsibility, recognizing you largely create your feelings through your beliefs, not just external events.
It sounds very empowering, actually.
It can be incredibly empowering, often quite direct, but it can lead to really profound shifts in how people experience life.
Okay, so we've got CBT focusing on thoughts, feelings, behaviors, challenging those automatic thoughts. And REBT digging into those deeper core irrational beliefs, the musts and shoulds. How do they stack up side by side? What are the main similarities and differences?
Good question. Let's start with similarities. The big one is that both are built on the fundamental idea that our thinking, whether it's thoughts or deeper beliefs, strongly influences how we feel and act.
Okay, that's the common ground.
Right. And both are active approaches. You, the person seeking help, are actively involved. You're doing work, identifying thoughts, challenging beliefs.
Not passive therapies.
Definitely not.
Yeah.
They're also both generally structured, goal-oriented. There's a plan, skills to learn.
Makes sense. And the key differences.
Well, as we've touched on, CBT often zooms in more on those immediate automatic thoughts and common thinking errors, things like black and white thinking or catastrophizing.
The surface level cognitive distortions.
Kind of, yes. Whereas REBT really makes a point of going after those core philosophical assumptions, those rigid demands, the masturbation, as Ellis sometimes called it.
Okay. That's memorable.
It is. And in terms of techniques, CBT might more frequently use things like behavioral activation, getting you doing rewarding activities or systematic exposure for anxiety.
Right. Facing fears gradually.
Exactly. REBT, while it values behavior change, also heavily incorporates emotive techniques, things specifically designed to stir up and challenge emotions directly.
Like what?
Things like rational emotive imagery, vividly imagining facing a difficult situation while practicing rational thinking and feeling appropriate rather than overwhelming emotions. Or shame-attacking exercises.
Shame attacking. What's that?
It involves intentionally doing something you find embarrassing, but that isn't actually harmful or unethical, like wearing mismatched socks or asking a silly question in a store to prove to yourself that you can tolerate disapproval or looking foolish, and that it's not catastrophic.
Wow, that sounds...
It can be. It directly challenges the belief, I must have everyone's approval. But, what's really common now is that many therapists are trained in both.
They integrate them.
Absolutely. They draw techniques from both CBT and REBT, tailoring the approach based on what the individual person needs. It creates a really powerful and flexible toolkit.
That makes a lot of sense. Okay, this is super helpful in understanding the theories, but let's get really practical now. This is what I know you listening are keen on. How can we start using some of these ideas in our everyday lives? Right now, maybe without seeing a therapist.
Yes, absolutely. This is key. You can definitely apply the principles. Let's take a common situation feeling really anxious before a big meeting or presentation.
Okay, yeah, happens to many of us.
Using a CBT approach, the first step is to try and catch those anxious thoughts. What specifically are you telling yourself? Is it, I'm going to blank completely? Or maybe, Everyone will see how nervous I am and think I'm incompetent.
Pinpointing the actual fear.
Exactly. Once you've identified it, you start questioning it. What's the evidence for that thought? Have I always blanked? What's the evidence against it? Maybe you've given okay presentations before. Then you consciously try to generate a more balanced thought.
Like what?
Like, okay, I feel nervous, which is normal, but I've prepared. I know the material. I can handle feeling uncomfortable. Or even if I stumble a bit, it's unlikely to be a total disaster. It's about realism.
That feels manageable. A way to dial down the panic. What about an REBT angle for everyday use?
Okay, let's say you get some critical feedback or maybe face rejection, a job application perhaps, and you find yourself feeling utterly worthless, just really beating yourself up.
Yeah, that downward spiral.
Right. An RBT approach would encourage you to look for the underlying belief. Are you operating from a belief like, I must always succeed and be approved of, and if I'm not, it means I'm a failure as a person?
That demanding belief again.
Yes. And you'd challenge that. Is it actually true that you must always succeed? Is that even humanly possible? Does one rejection truly define your entire worth? Who says so?
Questioning the core assumption.
Precisely. Then you'd work on replacing it with a more rational, self-accepting belief. Something like, I prefer to succeed and be liked, but I don't need it to accept myself. Rejection is unpleasant, but it doesn't make me worthless. Practicing that unconditional self-acceptance.
That feels deeper, like shifting a foundation. What about something like procrastination? Many people struggle with that.
Oh, definitely. You could tackle that from both angles. CBT might suggest behavioral activation. Break the task down into tiny, tiny steps. Don't focus on write the whole report. Focus on open the document, then write one sentence. Small wins.
Make it less overwhelming.
Exactly. And REBT would challenge the beliefs that fuel procrastination. Beliefs like, I must feel inspired or motivated before I can start, or if I can't do it perfectly, there's no point starting at all.
The perfect or nothing trap.
Right. You dispute those. Do you really need to feel inspired? Can you act even if you don't feel like it? Is doing something imperfectly truly worse than doing nothing? Challenging those beliefs can free you up to just start.
These are really practical, usable examples. Thank you.
Mm.
And if people listening feel these ideas resonate and want to go further.
Well, if you're dealing with significant issues or just want structured support, definitely consider finding a licensed therapist. Look for someone trained specifically in CBT, REBT, or approaches that integrate them.
Professional guidance.
Yes. But there are also fantastic resources for learning more on your own. For CBT, Dr. David Burns' Feeling Good books are classics, really accessible and full of techniques.
Okay, feeling good.
For REBT, the original source is great. A Guide to Rational Living by Albert Ellis himself, co-authored with Robert Harper. It lays out the whole philosophy.
At least his own work.
And, for ongoing learning, especially through video, Dr. Steve Johnson's YouTube channel is excellent. It's called Psychotherapy Education and Training. Lots of clear explanations on both CBT and REBT concepts.
Great recommendations. We'll make sure those are accessible. Listening to all this, it's really clear that CBT and REBT aren't just therapy models for specific problems.
No, not at all. They're really life skills, wouldn't you say?
Yeah, fundamental skills for navigating the ups and downs more effectively.
Absolutely. Just understanding how your thoughts and beliefs create your emotional reality, that understanding alone gives you so much more power, more agency.
The power to change your experience.
Exactly. It's a message that you don't have to just be stuck feeling bad. There are concrete things you can learn and do. Tools are available. Help is available.
It's an empowering perspective. So maybe a final thought for everyone listening.
Yeah.
As you go about your day-to-day, maybe just notice one moment where you feel a negative emotion, anxiety, frustration, whatever, and ask yourself, could I apply a tiny bit of CBT here? What's the thought? Is it 100% true? Or maybe think about a long-held rule you have for yourself, an REBT should or must. What if you questioned that rule just for a moment?
How might that shift things?
Exactly. How might consciously using one of these ideas change your experience of just one everyday challenge? Something to think about.
A powerful question indeed.
Thanks for taking this deep dive with us today.